Basketball legend LeBron James' son suffered cardiac arrest during practice earlier this week. 18-year-old Bronny James is recovering, but his case raises the question, how does a healthy young athlete suffer a life-threatening attack? Cardiovascular disease specialist Dr. Kumar is on call this morning to explain. So good to see you. Thank you. It's really such a concern for everyone, especially seeing this young, healthy. How unusual is this?
I mean, it's really a rare occurrence, 1 in 100,000 cases per year, but we've seen it quite commonly now. Now, a sudden cardiac death, what happened to Bronny James,
Sudden cardiac arrest.
Right. Or we call it a sudden cardiac death, is actually a result of an electrical disturbance in the heart that prevents the heart from pumping blood to the rest of the body. Now, we see about 1,000 cases a day in the United States. Mortality rate is about 90%, but for these young athletes, it's about 1 in 100,000.
Thank goodness they had that defibrillator right there.
Absolutely.
What's the difference between that and a heart attack?
Right. So a heart attack is the result of reduction of blood flow to the heart. Now, a heart attack can cause a cardiac arrest or a sudden cardiac death, but they really are two completely different disease processes.
Okay, well, that's so interesting. What causes it? I mean, I think that's what everybody's wondering, especially for a person who's in top physical condition.
Absolutely. So structural heart disease is at the top of the list, and that can be inherited or acquired, or an arrhythmia. Now, there are certain genetic arrhythmia type syndromes, or you can develop an arrhythmia from medication use, electrolyte abnormalities, and finally coronary artery disease.
Okay, so that's going to be something we haven't heard yet what it could actually be in this case, right? Earlier this year, Buffalo Bills player Damar Hamlin, this happened to as well, and boy, that caught everybody like by surprise, right? So how does what happened to Bronny James compare to what happened to Damar Hamlin?
So it seems like the causes are different, because with Damar Hamlin, it was a blow to the chest that caused an arrhythmia. We're still waiting to see exactly what the cause was with Bronny James, but I want to say there's a lot of similarities here. First off, here are two young, healthy athletes. The good parts here are that these arrests were witnessed, so they got fast CPR, early defibrillation. They were both in optimal physical condition, and I think the prognosis is going to be very good for Bronny James.
How about that? How do you treat a condition like this?
Okay, so if you see somebody go down, the first thing you want to do is call 911 and start CPR. That's 100 compressions in 1 minute, and those rescue breaths are not an essential part of CPR, but the single most important thing is early defibrillation. Every minute that goes by without defibrillation, mortality increases 10%. So that's why, I mean, this is really, I think, a signal from the universe. We have two athletes in almost 6 months. Every field, every court, wherever there are kids playing, training, should have a defibrillator nearby.
So true. I mean, thank goodness we've seen many more of them, but you're absolutely right. There are so many that still don't. So that's good advice. Before we let you go, I just wanted to ask you about this excessive heat that we're dealing with the next few days. Just give us just a little bit of advice for our viewers in order to stay safe through this. These next few days are going to be tough.
Well, these heat waves, the cardiovascular system bears the brunt of them, because as our body is trying to regulate temperature, we have fluctuations in blood pressure, heart rate, and during these heat waves, cardiovascular events increase threefold. That's heart attacks and strokes. Okay, so vulnerable populations. If you're on blood pressure medication, if you are elderly, you really want to avoid being outside. And if you have to be outside, then come inside, take breaks to cool off. Recognize that when it's humid, it's harder for the human body to cool off, because the way we cool off is we sweat, we evaporate. It's hard to do that in the humidity. Hydrate, 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 avoid alcohol, and try to consume cold fluids. By drinking cold fluids, you bring down your core body temperature. It's a great way to cool off.
Dr. Kumar, thank you so much. Really great advice for everyone, and we'll be right back.